Yeah, so the forums that are designed at ADPD are really quite exciting because it really demonstrates this ecosystem amongst academia, industry, foundation partners, and some of the most important conversations that came from it is where we're going with regulation. So there are expert level tertiary clinics where you have this subspecialty, but are we already forward thinking enough to think about how community care would look? So we want to be really cautious at this standpoint to make sure that we have highly accurate biomarkers such that an individual who maybe doesn't have expertise in Alzheimer's disease wouldn't necessarily overinterpret. We're moving earlier and earlier in the disease course because we want to understand, just like with hypertension, if you start to show that you have high blood pressure, maybe you're going to start doing some lifestyle modifications, or maybe you'll even start to consider some of the hypertensive drugs. If we can think about Alzheimer's disease earlier and earlier, can we do something about it? And so these biomarkers, what's always very exciting is what do they represent? So on the fluid level, the targets we have now helps us capture much more of the earlier aspect of the disease, where neuroimaging helps us a little bit more of the advanced state, the neuronal death, and those in combination can be really useful. But what's important is the fluid biomarkers helps us to have greater access of care. And so I think that was a lot of the more exciting topics that came about. So I think there's a number of things that still have to be done. One, public health awareness, meaning if you're starting to have kidney difficulties, do you want to address it? So for societal awareness, the goal is to ensure education, especially if there's any kind of lifestyle modifications. There's some theories out there that we have maybe as much as 40% modifiable risk factors, which is very important, especially that relationship between vascular disease and Alzheimer's disease. But I think it'll be society and also level of education for the practitioners of this. And so there's a lot to be done. I think it'll be, once again, more on the accuracy side and understanding, is there combinations that could really be helpful for prediction.